Your eyes aren't just for seeing, they're a direct extension of your brain. The retina, that thin layer at the back of your eye, actually develops from the same tissue as your brain. This means the retina shares many features with the brain, including cell types and blood vessels. It's the only part of our central nervous system we can examine directly, making it a unique window into brain health. Researchers are now using this connection to look for signs of mental health conditions like schizophrenia and depression. Traditional diagnosis relies on subjective reports, but the retina could offer objective biological markers. Changes in retinal thickness, blood vessel patterns, or light response may signal underlying brain disorders. So a simple eye exam could one day help screen for mental health issues. This is transforming how we think about both eye and brain health. Scientists use advanced, non-invasive imaging to study the retina in detail. Optical coherence tomography, or OCT, scans the retina's layers with light, revealing changes as small as a few thousandths of a millimeter. This is crucial, as some mental health conditions are linked to subtle thinning or thickening of specific retinal layers. Fundus photography takes high-resolution images of the retina and its blood vessels, helping spot patterns tied to brain health. These tools are quick, painless, and already common in eye clinics. If strong links are confirmed, retinal screening for mental health could become routine and accessible. Together, OCT and fundus photography provide a comprehensive view of retinal and potentially brain health. This technology could revolutionize early detection and monitoring of mental health conditions. Research is revealing clear links between retinal changes and mental health conditions. For example, people with schizophrenia often have a thinner retinal nerve fiber layer, mirroring brain changes seen in the disorder. Similar thinning is found in depression and bipolar disorder, and electrical responses in the retina can be weaker in depression. In Alzheimer's, retinal thinning may appear years before memory loss, while Parkinson's affects dopamine-using retinal cells. These patterns could serve as unique retinal signatures for different conditions. Eye exams might one day help distinguish between disorders with overlapping symptoms. This could lead to earlier, more accurate diagnoses and targeted treatments. The retina offers a non-invasive way to track disease progression and treatment response. It's a promising step toward integrating eye health into mental health care. The idea of using retinal imaging for mental health is exciting, but there are challenges. Early detection could transform care, allowing for timely intervention and better outcomes. Retinal scans might provide objective measures of treatment progress, moving beyond subjective reports. However, similar retinal changes can occur in different conditions, so more research is needed to pinpoint specific markers. Large, diverse studies are essential before eye scans can reliably diagnose mental illness. The goal isn't to replace traditional evaluation, but to add valuable biological data. By combining retinal imaging with other assessments, we can build a fuller picture of mental health. This integrated approach holds real promise for earlier diagnosis and better treatment for millions.